So you just bought health insurance, but now you're wondering what the heck is covered and how much will I have to pay for a doctor's or hospital's visit? Well, if these questions sound familiar to you, then this video is for you. Because today, I'm going to walk you through sample plan documents so you can learn how to navigate your own and find out what's covered under your plan. Let's get started. Hey guys, and welcome back to my channel. If you're new here, my name is Shamy. I'm a healthcare finance consultant, and this channel is all about helping you understand your health insurance to save money. So if that's something you're interested in, please subscribe down below. If you've watched some of my other videos, then you've heard me talk about the summary plan description, or SPD for short. Your employer is required to provide it to you if you get your health insurance through your job, and you can find it by logging into your health insurance portal online. This document shows what your plan covers and the amount that you're responsible for paying, like your deductible, your copay, your coinsurance, and out-of-pocket max. And if you need a refresher on what these terms mean, definitely check out my video on how health insurance works or my short 5 common health insurance terms explained. Now, the SPD summarizes your plan in plain English to make it easy for the average person to understand. It includes things like who's eligible for the plans, your benefits and coverage, and your rights under the plan. But in this video, we're going to cover the benefits and coverage section so that you can find out what coverage services are under your plan and how much you're responsible for paying. I'm going to review 2 sample SPDs with personal information redacted because your SPD may look different and there's no standard format. Remember, I'm not recommending or analyzing a specific plan, just showing you how you might navigate your SPD so you can do the same with your plan and figure out what services are covered. Let's get started. So this is an SPD of a high deductible health plan, and you can see it starts off with a table of contents, which contains things like definitions of terms you might have questions about, medical benefits and covered services. Now, this is where we're going to be spending our time because these sections are going to answer the questions: what is included under my plan or what is covered under my plan, and how much am I responsible for paying. Chapter 2 also includes limitations and exclusions. So that's services not covered by your plans or certain limitations to those services covered by your plans. This SPD also includes prescription drug benefits, care coordination programs, and Chapter 5 is a catch-all of things like general information and how to file a claim. But let's jump into medical benefits in Chapter 2. So here you can see it starts off with deductibles, and it has the different deductible amounts separated by plan type, individual or family. And the nice thing about this SPD is that it also includes a definition of the deductible right beneath the table in case you forget, which is the amount of eligible expenses you must pay each calendar year for certain covered services before your plan pays the benefits amount. So long story short, it's the amount you're responsible for paying in your doctor's bills and your bills from your hospitals before your health plan starts paying for anything. So for an individual plan, your deductible for in-network services would be $1,750, or for out-of-network services, it would be $3,500. But for a family plan, that deductible for in-network services is $3,500 and $7,000 for out-of-network services. So what this means, for example, is if you have an individual plan and you see your doctors in network, then you're responsible for paying the first $1,750 of your care in medical bills before your plan will start to pay for some of it. Now moving on to the next page, which is the out-of-pocket maximum. And you can see it's a similar setup to the deductible page where it has the definition of out-of-pocket max beneath the table, which is the most you'll pay in covered services in the plan year. And after that, your plan starts paying for 100% of covered services. So for an individual plan, the out-of-pocket max for in-network services is $3,500 and it's $7,000 for out-of-network services. But for a family plan, the out-of-pocket max for in-network services is $7,000 and it's $14,000 for out-of-network services. So the way you would read that is if you have a family plan, and you all are seeing your doctors in network, then once everyone in that family, so combined, spends $7,000 on covered services that are in network, your plan would pay for 100% of in network services afterwards. Now, this next section of the SPD lists the services covered by your plan, and it does so by rolling them up in a high level service, which is in blue here, and then specific services for those services in the white and gray rows beneath it. And this reads like a restaurant menu in the sense that on the left hand side, you have the services or the food. And the right hand side, you have the prices you pay for those services, which in a health plan is your coinsurance or your copay. And here it's also divided by in network and out of network services. So I'm going to jump to the maternity services section so we can review that together. So you can see here we have maternity services in blue, and then beneath it, you have the different types of services included in maternity services, like inpatient hospital stay for the mother and the newborn child, the delivery of the child, anesthesia use, diagnostic testing done, and other services, including birthing classes. And if we were to interpret, for example, how much you'll be responsible for paying for birthing classes, well, if you receive them in network, the plan pays for 80% of the allowed benefit after your deductible, meaning that you're responsible for 20% of the allowed benefit after you meet your deductible, or you have a 20% coinsurance. And if you were to get these birthing classes done out of network, then the plan would pay for 60% of the allowed benefit after you meet your deductible, and you'd be responsible for 40%. And if you want more information about what the allowed benefit means under this plan, then you would hop over to Chapter 1 in the definition section. But now jumping ahead to the covered services section, this section contains more detailed about the services discussed in the medical benefits section that we just looked at, and it might include things like caps for services or timing of services as it relates to coverage. And again, let's look at maternity services to see the additional level of detail provided in this section. So over here in maternity services, you'll see that it lists some of the services that we saw in the medical benefits section, but it includes additional detail here. So, for example, it says right here that benefits are available for one birthing course per pregnancy. And in the medical benefits section, it didn't say how many birthing courses were covered, just that there was an 80% amount that the plan would pay for if it was in network, and 60% amount the plan would pay for if it was out of network. But here you can see that it's covering one birthing course per pregnancy. And also here, we saw in the medical benefits section that inpatient hospital stays were covered. But here you have more information about the timing of those stays. So they cover inpatient hospital services for a minimum of 48 hours following an uncomplicated vaginal delivery. Or if you had an uncomplicated C-section, they cover a minimum of 96 hours following that. And cover up to 4 additional days of routine nursery care if you're required to stay in the hospital for medically necessary reasons. So, this section is giving you more details about timing and caps and number of services covered that you didn't get in the medical benefits section. Now, looking at a different SPD with a different structure. This one's for a PPO plan, but let's dive into it. So this also starts off with a table of contents, but you can see right off the bat here that information is organized differently than it was in our last SPD. So for example, the deductible has its own section here, as does the out-of-pocket limits, which were all in the medical benefits in the last SPD. And here we have a covered services section, which is going to be a combination of medical benefits and covered services that we saw in the last SPD. So let's jump into it. So we're in the deductible section, and you can see right off the bat this plan has different types of providers. So we're not just simply dealing with in-network and out-of-network providers. Here there are three tiers of providers, tiers 1, 2, and 3. And tiers 1 and 2 are in-network providers, but they're of different groups. So they call tier 1 network providers. Tier 2 are a different group of providers, which I've redacted. And tier 3 are your non-network providers, which are similar to your out-of-network providers. But like the other SPD, you have your deductibles divided into individual and family plans. And here specifically, they define a family plan as having 3 or more persons in it. So you can see here the deductible for an individual plan, if you're seeing tier 1 providers, is $125. For tier 2 providers, it's $300. And for tier 3 providers, it's $750. Whereas the deductible for the family plan is $375 for up to, for those 3 plus people in those plans, $900 for the people in that family plan and for tier 2 providers, and $2,250 for tier 3 providers. So now let's move on to the out-of-pocket max. So moving on to the out-of-pocket limits, which is also called your out-of-pocket maximums in different plans, you'll see that this SPD has it organized differently than the last SPD. So on the top row, you have your medical out-of-pocket limits for your medical claims. And then on the bottom row, you have your prescription out-of-pocket limits for prescription claims. And we're just going to focus on the top row medical claims for now. So different than the last SPD, and even in the table for the deductible of this SPD, you'll see that the out-of-pocket max is defined on a per person level, so you can calculate that for individual and family plans. And what I mean by that is, for example, for tier 1 providers, that out-of-pocket max for medical claims is $1,500 per person, with a maximum of 3 individuals within the family. So if you have an individual plan, then your out-of-pocket max is $1,500. But if you have a family plan, it can be up to $4,500. So that $1,500 times 3. And for tier 2 providers, the out-of-pocket max is $3,000 or up to $9,000 for a family plan. And if you were to see physicians or have medical claims for tier 3 providers, then you'd have an out-of-pocket max of $12,500 per person, or a maximum of $37,500 for a family plan. So now moving on to the covered services section of this SPD, you'll see that it's a combination of the medical benefits in the last SPD and the covered services in the last SPD. So in the same section, we're going to get a detailed list of services and the responsibility of the plan and the patient to pay for those services, as well as that extra detail, such as things including caps on services or timing on services. So looking at covered services for maternity care, you'll see that on the left-hand side, you have the different services covered in maternity care, and then your responsibility and the plan's responsibility according to the tier of providers that you see. So, for example, for um, you know, uh, the physician delivery, your plan is going to pay for 90% of care after you meet your deductible, while you're paying for 10% after you meet your deductible for tier 1 providers. For tier 2 providers, your plan is paying a little bit less, or paying 80%, which means you're paying a little bit more. You're paying 20% after you meet your deductible. And then for tier 3 providers, your plan is paying 50% of the usual and customary and reasonable fees after your deductible, which is what the UCR means. and then you're paying for the remainder of the charge afterwards. And similar to the covered services section in the last SPD, you'll see up here you have that additional detail about the timing of services, where it tells you that the plan is going to cover for inpatient care for a minimum of 48 hours after vaginal delivery or 96 hours after a C-section. So you get that information all in one section in this SPD versus in two separate sections in the last SPD we looked at. So that is how you read an SPD to know what services are covered under your plan and how much you're responsible for. And now that you know how to do that, definitely check out my video on how to estimate your healthcare costs before your procedure so that you're not caught off guard by your healthcare expenses. Enjoy.